Hello, I am Dr. Lia Perez. I'm a senior member and full professor at Moffitt Cancer Center in the Department of Blood and Bone Marrow Transplant and Cellular Immunotherapy. Thank you for giving me the opportunity to share with you our exciting results of our clinical trials when we tested the use of panobinostat with tacrolimus and sirolimus for graft-versus-host disease prevention. We had been excited about this project since we initially tested the use of panobinostat for graft-versus-host disease treatment. We established the maximum tolerated dose, which was 5 milligrams BOTIW, and therefore we did establish their MTD and as well as a good exciting data as far as GvHD response. Therefore, we embark on to this new study, whether we tested the combination, and our goals were to reduce the rate of acute graft-versus-host disease from historical control of around 50% to around 30%. So tacrolimus was started on day -3, sirolimus on day -1. This has been our backbone for graft-versus-host disease prevention in our transplant center. And we started panobinostat on day -6 or 5 pre-transplant, and we continued this as far as a total of 26 weeks. We enrolled a total of 38 patients in this study. We have excellent engraftment. As far as tolerability of the drug, we really observe very minimal mild GI symptoms or thrombocytopenia and neutropenia. The exciting information to share here is that 18% of the patients develop acute GvHD, a total of 7 out of the 38 patients. Most of these patients develop grade 2 GvH, and only 1 patient developed grade 3. Exciting even more is that half of the patients that develop grade 2 require the use of steroids. As far as a chronic GvHD rate, it was in the order of around 31%, and very, very few patients, 13%, develop moderate and severe chronic graft-versus-host disease. We are also excited to share that the relapse rate was around 18%. The relapse-free survival at a year was 77%, and the overall survival at 1 year was 87%. So we also tried to, we did studies in many T-cell populations, and what was clearly from the data that the Treg numbers measured by flow cytometry increased in those patients that were treated with panobinostat and did not develop graft-versus-host disease compared to those that did develop GvHD that ended up being only, as I shared with you, 7 patients. We did also measure acetylation of histone 3 in the Treg population, and we did observe an increase of the acetylation in the T regulatory compartment. As far as the measurement of elafin, REC3, and ST2, we did not observe any differences. So in conclusion, and I'm happy to share that yes, I do think that the use of tacrolimus, sirolimus, and panobinostat for GvHD prevention have resulted in very exciting data with only a 17%, 18% rate of acute graft-versus-host disease. Therefore, yes, sure, I do recommend the use, although, as you know, this is a phase 2 trial, and testing in a more stringent environment like a phase 3 study is highly advisable. Thank you very much for the opportunity to share our data. Thank you.